much رشا، بنشكرك العرض الرائع اللي قدمتيه الحقيقة، يعني outstanding بصراحة، والحقيقة يعني كل أولادنا النهاردة كانوا حلوين جدا. اتفضلي يا دكتورة شيرين.
بشكرك يا رشا على الكلام الحلو اللي قلتيه الحقيقة، وفي أسئلة كتير، موضوع يعني شيق وجميل. ودلوقتي احنا زي ما بنقول ختامه مسك، احنا هنختم بابننا العزيز مصطفى الأمين. الحقيقة مصطفى يعني إنسان، يعني قبل ما يكون طبيب هو إنسان مخلص جدا ومتفاني في عمله واوتستاندينج الحقيقة. شغله في الوحدة احنا بنعتمد عليه في حاجات كتير، وهو مجتهد وربنا يوفقه إن شاء الله دايما يا رب، وبيقبل التشالنجز دايما حتى مع العيانين. ويمكن عشان كده النهارده اختار الموضوع ان هو التشالنجز ان ذا مانجمنت اوف هيريديتري انجيوديما. اتفضل يا مصطفى.
شكرا دكتور شيرين. في البدايه احب اشكر يعني كل اساتذتي وكل يعني سينيور كوليجز اللي معايا في الوحده، ان هم يعني they give me this opportunity ان انا اكون واحد في عائله وحده الحساسيه والمناعه، وكمان الاوبورتيونيتي ان انا ابقى يعني مشارك في حدث يعني جلل يعني زي ده، وان شاء الله يعني اكون عند حسن ظنكم جميعا باذن الله. انا هعمل شير سكرين. بسم الله الرحمن الرحيم. My presentation will be about challenges in the management of hereditary angioedema. First, we have two sets of challenges. Challenges for physicians. The topics that were addressed in the IACI Congress were two topics. First, that among physicians, it was always hard to be always up to date with new diagnostic and management regarding hereditary angioedema therapies. And there were risks of stopping or switching prophylactic treatment methods. In a study called Online Education Yields Significant Gains in the Physician's Knowledge of the Latest Data in Hereditary Angioedema Therapies, the authors hypothesized that accessing the growing field of knowledge and always searching for published papers is always difficult and time-consuming for physicians, especially in the current pandemic. So they developed an online continued medical education tool titled New Findings in Hereditary Angioedema, an expert evaluation of the latest data. The goal of this tool was to assess whether online continued medical education activities and tools help to improve the physician's knowledge of the latest data on hereditary angioedema. 62 physicians specializing in allergy and clinical immunology shared in this study. They answered a four-question assessment before and after watching a 30-minute video. This activity, watching the video, had a significant impact on the knowledge of physicians. The percentage of correct responses rose from 36% before watching the video to 63% after. 33% of physicians improved their knowledge and 30% re-knowledge. What's really important is that 50% of the physicians recognized improvement in their ability to apply this new data to their clinical practice. This study concluded that online continued medical education activities significantly improve physicians' knowledge, but there were limitations in this in the tool they developed, as 30% of physicians had no change in their answer before and after watching the video. The second topic I am going to address is the risks of discontinuing prophylactic treatment modalities, especially androgens, for hereditary angioedema. The authors studied the effects of androgen discontinuation on disease activity and adverse effects among 10 hereditary angioedema patients. Androgen is now used less among hereditary angioedema patients due to its frequent and potentially severe side effects, and it is always discontinued due to contraindications, unplanned pregnancies, and insufficient disease control. They studied 10, as I mentioned earlier, they studied 10 hereditary angioedema patients. 5 of them, 50%, had increase in attack frequency and severity in the initial post-androgen period, which required additional management with on-demand recombinant C1 esterase inhibitor. One patient had a severe life-threatening attack requiring hospitalization and an emergency glycothyroidotomy. 2 patients had post-androgen side effects, including depression, weight gain, and anxiety. And 2 patients returned to their original androgen therapy. Among the 8 patients who did not return to the original androgen therapy, on the long term, they had significant improvement in disease control and in their quality of life. The authors concluded that on switching from androgen to other treatment modalities, it is always prudent to continuously monitor patients in the initial post-androgen post-androgen period after androgen discontinuation. After this period, the transitioning from androgens to alternative prophylactic medications significantly improves patient outcomes. This study, as I mentioned, was, however, limited to 10 patients only, so further research is required in this field. Lastly, challenges in the management of hereditary angioedema are not only faced by doctors, they are also faced by patients and caretakers. So a study called Health-Related Quality of Life in Children with Hereditary Angioedema as compared to patients with histaminergic angioedema. The authors conducted a study that evaluates the health-related quality of life in children with hereditary angioedema as compared to both histaminergic angioedema patients and healthy controls. All patients and their parents answered adapted health-related quality of life questionnaire. The results were that the total score of health-related quality of life was significantly lower in both the histaminergic and the hereditary angioedema groups, lower than the healthy control group. However, the family scores and the total scores were significantly lower in the hereditary angioedema group than the histaminergic angioedema. Among the hereditary angioedema patients, the physical well-being scores were better as the age of onset becomes later, and were worse as in patients who had significant abdominal attacks. However, the older age of onset was correlated with worse self-esteem scores. This could be attributed to the fact that older children and adolescents have a more complicated and a more complex self-image, and they are subject to higher levels of peer pressure. Thank you very much. I hope I could deliver my presentation in a good way, and I would thank again everybody, my seniors and my professors, for giving me this amazing opportunity. And may Allah bless you all, and may Allah bless Dr. Yahya's soul, and may he rest in peace and in heaven. Thank you.
شكرا يا مصطفى على التقديم الرائع ده. الحقيقة أنا سعيدة بيك جدا النهاردة، يعني دي أول مرة تقدم، بس أنا مبسوطة بيك جدا بصراحة. ما شاء الله عليك، يعني مش مجاملة ومش حاجة، مش عشان أنت ابني وأنا يعني لا، بحقيقي أنا مبسوطة بيك، وقدمت بطريقة جميلة ومتمكن وواثق، ويعني معاك وحوش في التقديم النهارده، مش عايزه اقول انما ما شاء الله عليك. انا سعيده جدا بيك وسعيده بالتقديم بتاعك، you tackled very important points. وانا محضره لك سؤال بعد ما نشوف الاسئله اللي هتجي لنا ان شاء الله من الساده الحضور.
شكرا لحضرتك دكتور شيرين. شكرا.
نبتدي دلوقتي الأسئلة مش كده؟